And advocates are urging the state to make it easier to get mental health care. Atlanta News First reporter Abby Kasouris explains what providers, patients, and lawmakers want to see done to connect people with the services they need.
According to the National Alliance for Mental Illness, 1.4 million Georgians have a mental health condition. More than half didn't receive treatment last year, most citing costs.
It's like $250 an hour. I guess I won't get help, right?
Malika Holloway says she's glad she found another option. Her therapist, Jonathan Tucker, helped her when she was a danger to herself.
You know, the saying is, if it don't make dollars, it don't make sense. And as we're continuing trying to monetize various things, if we're not seeing money come from it, then there's not a rush to deal with it.
Tucker is one of the state's 14,000 trained mental health professionals. He says many people don't know they can file a complaint to get insurance coverage under the Georgia Mental Health Parity Act. When it was passed in 2022, the Mental Health Parity Act was seen as a huge win, making sure that insurance companies cover mental health and substance abuse like they would a broken arm or chemotherapy treatments. But talking with people today, they say it's not happening. State Representative Mary Margaret Oliver co-authored the legislation. She says it needs teeth.
The insurance industry is blocking too many reforms that we need to move forward with.
At the Carter Center's Mental Health Parity Day, Oliver announcing incoming legislation to require insurance companies enforce parity.
We have some catch up to do.
Carter Center Mental Health Program Director Eve Bird says to advance mental health care policy, Georgians need to know their rights. They're going door to door with a new campaign.
Our work will not be over until every Georgian knows that it is that if they have public or private health insurance, they have coverage for their mental health treatment, and their insurer is covering the health of their mind on par with the rest of their body.
It's in line with their founder's goal. Rosalind Carter, a champion for mental health parity.
It's like unacceptable. And to know that people, they don't know and they don't have access, they can't afford it.
The Carter Center says their latest campaign will focus on underserved communities, especially talking to women who make healthcare decisions for their whole family. Last year, a campaign in Albany and Savannah meant that other families were signed up for critical care. In Atlanta, I'm Abby Kasouris.